trauma. Here the infection caused inflammation, it healed with the scar, right? And there is a no uptake. So there is a photopenic area or there is no uptake with the loss of contour. That is only qualified as a scar. Rest other areas where it has not lost the contour, it is photopenic areas which is representative of pyelonephritic induced edema. Then this is we were in a dilemma in this patient whether to do to stop her leaking, right? Whether to do just augmentation and rely on CAC, or we have to do augmentation with the bladder neck tightening and then CAC or mitrophenol. So Dr. Hemant Pathak was there during this case we operated in training course, and he said that let us have this simple test. So we emptied the bladder with a small catheter, and she was allowed to drink and to do normal activity. She reported leak after 60 minutes. Bladder was immediately emptied again, putting catheter, and it drained 70 ml. So we could realize that at least she is maintaining 60-70 ml of urine without leak in a period of 1 hour. And that is probably is a suggestion that there is a good bladder neck resistance. So we don't want to go for a procedure which has become more lengthy and more problematic, can invite some more complications. So this time we thought that we let us not to do anything with the bladder neck. If she continue leak, we may think about the sling because her urethra was quite okay, right? So in summary, this was a case of neurogenic bladder, never received treatment. She has incontinence on diapers, not voided on her own, no feeling sensation since many years. Both kidney preserved with the preserved renal function, small capacity with thick wall bladder, and she is working and seeking our help to be tracked. So what are the options? CIC only, which she was willing to do. CIC no problem, right? But likely that how frequently CIC. She is working into the she is living in the Himmatnagar. From there, she has to travel 2 hours to Ahmedabad, 8 hours of work, traveling back to so 12 hours. So you can imagine that without augmenting, it is not feasible to have that much number of CIC, right? Anticholinergics, no role because there is no overactivity, Botox not having any role. So augmentation with polyurethral CIC or mitrophenol. So we discussed both these options. Whenever there is a natural urethra which is normally there and there is no pain in these patients, our always preference is this. But as she said that I'm working, the mitrophenol will give me much more freedom of doing the emptying of the bladder without much issues. So she, after the discussion, she opted for the mitrophenol. We know mitrophenol procedure is not much difficult, but it is having its own